A middle-aged, slightly obese lady presents to my OPD with pain in her foot and ankle and with progressive deformity. On examination, he has obvious flat feet with heel going away from her ankle, and she was not able to go up on her toes, especially when we asked her to go on her single heel raise. She wasn't able to do that, and she was having a lot of pain in the around the inside of her midfoot area. Classically, this condition is called acquired flat feet or tibialis posterior tendon dysfunction leading to this condition. So these individuals typically have pain around the inside of their midfoot area, and they won't be able to heel raise, and that's why they face difficulty in, especially when taking stairs or walking on an uneven surface, and it looks like an exaggerated flat feet condition. This is a very common condition we come across in middle-aged, slightly obese individuals, especially in females. And in our foot and ankle clinics, this is a very common condition. And depending upon the severity of this condition, we stage them and treat them accordingly. Most of the time, or any of this case, they present at any stage. First, we try to deal with this condition non-operatively with the help of modified footwear, accommodative footwear, and special orthotics to prevent further progression, and giving enough rest, and followed by physiotherapy to help with their pain and prevent further progression of the deformity. Most of the time, non-operative management will help. When there is a failed non-operative management and they continue to have pain, then we subject them to surgical management, wherein we have to do some bony corrections as well as some soft tissue corrections in the form of tendon transfers. So one of the tendon which is not working here is the cause for this progression of the deformity. So we replace that tendon with another healthy tendon which is present just adjacent to it. So transferring the tendon, and also we shift the heel bone by making a cut in the heel bone and bringing it to where it should belong. So we are changing the biomechanics of the ankle so that the ankle lies right above the heel and help them in mobilizing comfortably. And these surgery helps them in getting back to their normal walking ability. So this condition is quite common in middle-aged, especially in females. And this is not a routine flat feet where we see, especially in children or in adolescents. This is a progressive deformity because of the non-functioning of the tendon. And this can definitely be corrected, and also we can make them pain-free, either in non-operative measures or if by surgical methods.